Hey everybody, I'm going to go ahead and demonstrate how to do the modified Robert Jones. Since we won't be having lab, I thought it might be helpful for you to watch the bandage be placed. Ready? So we're going to use Rufus, our model, which you would have been using in lab. And unfortunately, Rufus's legs don't all bend in normal positions. So you have to appreciate that in the regular patient, you would want to do this in the most normal anatomic position. We're going to do the best we can. So the first thing that we're going to do is we're going to place the stirrups, and so I've pre-cut several pieces of white tape here, and so we're going to put one stirrup on each side. I usually do it on the sides as opposed to the top and the bottom. And then once you have your stirrups in place, typically what we'll do is take a tongue depressor and we'll place it between the tape so that it doesn't get stuck to itself and you can easily get it apart when you need to pull them back. So here we have our stirrups in place, and then the first layer that we're going to put is our cast padding. This cast padding might be a little bit bigger than I would use for this particular patient, but you want to fit the cast padding size to the portion that you're bandaging. The cast padding comes in different sizes. There's 2-inch. This is actually the size I would probably use for this patient. You can see it's a little bit smaller, but this is all I have, so we're going to use this one. And then it also comes in this smaller size, which would be a size that I would use maybe for a cat or a small dog. It's a little bit small for this patient because it would take a lot to go up and down the leg. So we're going to start with our cast padding, and you want to make it fairly snug so that there's no wrinkles or gaps. And then, as I mentioned, we're going to try to make a 50% overlap as you go up the limb. And so you can see here, there's about a 50% overlap, and we're going to go up the leg. Now, if you try to pull this too snug, it will rip and come apart. So you just want to make it so there's no wrinkles. And we just continue to go up the leg. You want each pass to be the same distance as the one before. So you don't want to have like a bunch that are really close together here and then get far apart, because you want to have even compression all the way up and down the leg. And then as you get to the top of where you're going to make the turn and come back down, overlapping by 50%, making sure there's no wrinkles. And when you start this bandage, you do not want to cover the toes. You want to leave the toenails out at the very tip. We're going to leave those out, and then we're going to go back up again. So one pass up the leg is actually 2 layers, and we want this to be 6 to 10 layers. So as I go up the leg here, I get to the end. And this roll is going to work out perfectly. What you can do at the end is pull it, so the end frays like that, and then it will just smooth right on, and you won't have to worry about holding it in place. So you could add one more layer if you wanted to this bandage, but for the purposes of this video, we're just going to go ahead and leave this where we are. So the next layer is going to be our cling, which is more of a compression layer. So we're going to start right at the tip of the paw like we did before, and you're going to apply a little bit of pressure, but you don't want to make it super tight, just light pressure as you go around. With the same concept, we're going to go with the 50% overlap all the way up. And then I usually come back down as well. And then you will need scissors to cut this. You can't tear this. So we'll cut this. Smooth that over. Now it's time for our stirrups. So we're going to separate our tape. And what I usually do, and everybody does a little, you could just put it straight up, but what I like to do is I twist it around, and then I'll do a little spiral around the leg like that. Same thing on this side. So that they sort of crisscross, and these stirrups are going to help anchor your bandage and keep it from slipping down. So there's our stirrups that are in place. Then after our stirrups, we're going to go ahead and apply a layer of vet wrap. Now the vet wrap, we want to make sure we're unrolling the vet wrap so the roll's on top and the flat part is on the bottom. We don't want to unroll it in this direction. Okay, so always have the roll on top. Lay your vet wrap over the other portion of the bandage, and you want to come right down to the edge there to cover up the edge of your bandage. And I always unroll a little bit and then apply it. This can get very tight. If you pull it tight, it will be compressing to the point where you'll have potentially a bandage that's too tight. So you want to unroll it and then lay it in place, overlapping at 50%. And again, you can see I don't have any wrinkles. This is something that you don't want to be lazy about, because the wrinkles can potentially cause compression points, and that can cause sores even though you have padding underneath the bandage. So no wrinkles. And if you have a wrinkle, you can just back it up and relay it where you have no wrinkles in place. Cut it, and it just sticks to itself, so you just squeeze it down, and there's your modified Robert Jones. Now you can see I have the two toenails that are outside of the bandage. That's something you can have the clients monitor. If those toenails, they should be together. I can't move this dog's toenails, but the toenails are together, and they should check this daily. If the toenails are separating like this, that means the toes are swelling and the bandage is too tight. So a couple things else that I might do. These are just little tricks of the trade. Sometimes I'll take a piece of elasticon and I'll put this on the surface where they're going to be touching at the bottom, just to have a little like no skid area, a little bit of extra protection. But you don't need to put that on there. That's just something that I like to do. And sometimes I will put a piece of white tape just around the top. It doesn't need to be tight, but it sort of covers that little bit of cast padding that is outside of the bandage. You can tab it so that you can get it off easily, and then you have a nice modified Robert Jones. Thank you.